Well, there are myths around mental health that can really stop people from reaching out for help. We continue to look at the myths and stigma that can create barriers for people seeking crucial resources. Joining us today is Chadwick Sutton, the Navigate Peer Support Specialist from Network 180. He's here to help break down some of those barriers. Thank you for being here with us.
Thank you.
So let's just talk about what myths continue to exist when it comes to, getting mental health care.
So from a general mental health perspective, stigma is getting a bit better, but around serious mental health issues like schizophrenia and psychosis, it's actually getting worse. People generally have this belief that once you have psychosis, you can only hope to have a limited life. And programs like Navigate are working to show people that recovery and a fulfilling life, it can be the expectation for most people.
Yeah, talk about the Navigate program, expand on that, how it works and how it's helping people.
Sure. So Navigate is a coordinated specialty care program. It's designed to be holistic in nature. It serves people 15 to 35 who are having their first experiences with what falls under the diagnosis of psychosis. From an individual perspective, the person can look forward to one-on-one therapy, peer support, supported education and employment, of course, medication management, and some help with substance use if needed, but also because family is so important, we do have a family education component and family peer support as well.
And recovery, is a process. It's really different for everyone, right? Would you say?
Yeah. And one of the things to note is that medication is not the only thing that is needed. We need to help people rebuild their self-esteem. We need to build upon their strengths. We need to help them with building up tolerance to stressful situations.
How does, peer support help give a person hope?
So peer support works from a non-judgmental perspective, someone who has had similar experiences and doesn't need all of the details explained. We can hold hope for the person when they may not be feeling it themselves. And peer support's a little bit different in that it's kind of a mutual sharing experience that enables healing to be felt from someone who's kind of gone through the same process.
So what should a person do who believes, they need help?
So Network 180 has more than one way to help people. We have a phone number, our main phone line, that can be called 24/7. We have a mobile crisis response team that can also, the phone number can be found on our website and can help. And then we also have the Behavioral Health Crisis Center, which is located next to Trinity Hospital. It's available 24/7. And the goal there is to help people before things become a full-blown crisis, and hopefully they don't need inpatient hospitalization.
I think really the big thing, the big takeaway is the importance of receiving, the right treatment, right? Emphasizing that.
Definitely.
Okay, anything else that you want to share that I missed, Chadwick?
Also, since insurance can be a big issue that people are worried about, the Navigate program is proud to say that we are fully grant funded. Nothing about our services will ever show up on an insurance billing form.
Okay, thank you so much for coming on. Appreciate that.